Hello and welcome to Talking Treatment, the podcast for everything in the field of mental health and addiction treatment. Join us in listening to our episode as we will focus on highlighting industry trends with guest experts and healthcare providers from around the nation in the treatment industry who will share their unique perspectives on treatment. Ending the stigma on behavioral health and substance use disorders is very important to us. And the easiest way to do that is by talking about it. That's Talking Treatment. Today our guest speaker is Dr. Melissa Fenton, president of Mind, Body, and Beyond Center out of Jacksonville, Florida. So good morning.
Good morning. How are you?
I'm doing great, thank you. And thank you for joining our call today and our podcast. Please tell me about yourself. Tell me how you got into mental health.
Well, I've always been interested in the field. As a student in undergrad, I was a patient. I was recommended as a psychology major to pursue my own therapy, of which I did, and it was very, very helpful. And I thought, well, you know what, this is quite an interesting career and helpful to me, so I thought I would pursue it for myself.
And then you finished up at University of North Florida, is that right?
I did. Well, I finished up, after my undergrad, I did several years later, I was kind of out in the field doing things while my husband was finishing up his medical school training. But when I went back to school, I did start with my master's of counseling psychology at UNF, and then went on and got my doctorate in sexology.
And is that what led you to Mind, Body, and Beyond Center? How did you evolve into creating and becoming the president of that organization?
Well, thank you for asking. That was quite an organic evolution, as far as I had no idea that this was something I would pursue. When I originally started my master's and my doctorate, I started in private practice. It was called Coastal Psychology Group, so it was primarily traditional psychology. And along the way, throughout the years, I noticed that so many of my clients would need ancillary or other services beyond talk therapy to make them feel good about themselves. So such as they would talk to me about different things, whether it was depression or anxiety or divorce, different life transition things. And all the while, talk therapy is wonderful, but it's not sufficient. I recognized that they needed to exercise, they needed to eat more healthfully, they needed to do other things than talk therapy alone. So I would recommend that they would go maybe for acupuncture, maybe start an exercise program, or even get massage therapy to help reduce with anxiety and stress. And when I would make those suggestions and referrals to other practitioners in the community, they would come back, and invariably many of them would not have pursued those suggestions. So I started thinking, wouldn't it be nice if we could have under one roof all those different practitioners that I normally would refer out to? So therefore, instead of sending the referral out with them after they left my office, I could walk them to the practitioner down the hallway, introduce them, and get them set up. So it just seemed more fluid.
Interesting. And then you had mentioned that the talk therapy wasn't enough, and I know just from doing my research on Mind, Body, and Beyond Center, as well as yourself, that you incorporate EMDR therapy. Can you talk to us a little bit more about that, how you incorporated that?
Sure.
Helping your clients? And then I'm just from the website, I'm guessing this is a big piece of Mind, Body, and Beyond Center as well.
It is. It definitely is. When I mentioned, when I started after my master's and while I was in my doctorate training, I was in private practice, and I started to see, I would say, more of an influx of anxiety and trauma and grief clients coming through my door, and less so depression. It's interesting how it's evolved through the years in my practice of 17, 18 years being in the field. Originally, when I started out, the majority of my clientele was suffering from versions of depression. And but I would say shortly, around 2008 when things changed in the market, I saw a preponderance of anxiety and trauma and loss that had a lot to do with financial situations and divorce and more trauma, which led me to thinking I was ill-equipped with traditional counseling. I felt ill-equipped to address those concerns, even post-traumatic stress disorder, so real severe anxiety. So that led me to pursuing what was out there in our field of psychology, what is considered the best treatment besides cognitive behavioral therapy, or the different theoretical perspectives that I knew of from my master's and doctorate. And EMDR was the one that I found to be the most helpful. So I pursued my training in that, and I saw very quickly that it was extremely effective for my clients to reducing their anxiety and the symptoms of anxiety. So that's how I started that. I completed that in 2009, I think. So I've been doing it for a while, and I would say about 30%, maybe 40% of my practice is comprised of EMDR clients and that type of therapy.
Just to piggyback off of what you're saying, Dr. Fenton, since it does help clients deal with trauma, and we're seeing a lot of that even with our customers and our prospective customers, and just thought leaders, industry leaders in this space, trauma has really been brought to the forefront over the last couple of years. It's been such a heavy emphasis on, okay, if there is a behavioral health or addiction issue, let's go back and let's visit. Maybe there was trauma in your life, and trauma can be on a very wide spectrum, right?
Sure. I mean, there's those rare one-time event traumas, and then there's the majority of us have had multiple, what we call little traumas throughout our lifespan. And what we've recognized in research is if you have those little traumas, or you have childhood traumas, big traumas or little traumas, that impacts even more so if you have a current trauma. So it tends to be almost a cumulative effect. So those people that are experiencing trauma in their present lives, if they've had childhood traumas, big or small, they're less able to function as a result. So EMDR addresses current traumas and childhood past traumas as well.
So Dr. Fenton, we have a lot of our listeners that are clinicians. How could they start learning more about EMDR, as well as if you could explain what EMDR really does entail? I know it's what it stands for, eye movement desensitization and reprocessing, but what does that mean? Sure. What does a session look like? And then how can clinicians learn more about it and possibly start going to trainings and become licensed in that?
Sure. Well, let me start with how they can become trained in that. So there's an international and a national Emdr. So I think that's EMDR International Association that's where I got trained, and I think they're the largest training accredited facility, and they're all over the nation. So pretty much any city that you're in, if you look it up, you can Google it, you can see that there's I was trained in Tampa, and it generally takes 2 weekends, intensive weekends of training, and you start with 1 weekend, and then you have so many weeks in between where you work with what you've learned on your current client base, and then you come back and you have more of the advanced training with that, and then supervision for between 6 months or a year after with one of the Emdr instructors. So it's intensive, but it's highly beneficial for clinicians. I feel that if people are working in the field with people that experience trauma, if it's addiction, if it's behavioral health, anything that has to do with anxiety, trauma, PTSD, it's highly recommended that they be trained in that. There's also other techniques out there that have come since then, such as EFT. I'm not as familiar with that, but I can speak very highly about the benefits of EMDR and being trained in it.
Okay.
So as far as, yes, you did say it. I know it's a big mouthful. Eye movement desensitization and reprocessing. It's a lot to swallow. So EMDR is easier to say. It's amazing how much material is out there. When I first got trained in it way back in 2008, 2009. It may have, if I look, it could have even been earlier than that, but I think that's around the time. There was a lot of information, but the research has just gone through the roof since then. It started back in the 1990s with Dr. Francine Shapiro, and she was actually, I believe, she was a doctoral student at the time, and the process started with her thinking about a situation that was upsetting for her in her personal life, and she was just walking the landscape one day and thinking about something that upset her, and after she finished her walk and went back up to whether it was the lab or I don't know the specifics, she noticed she felt a heck of a lot better, and nothing changed with the incident that was causing her some distress except the fact that she did her walk. So being a scientist and being in her training, she thought, well, wait a minute, is this because I did some exercise? I know there's a lot of research out there about exercise and decreasing stress hormones and so forth, but no, it wasn't that. So she decided to really investigate and do some more research and see if she could replicate her findings. And what they came up with was, while she was doing her walk, she was obviously moving her eyes back and forth as she was just scanning the landscape. So she thought, why don't I see if there's some validity to moving the eyes back and forth? And that obviously gave birth to a whole slew of research. And there are a lot of theories out there. I mean, we're not absolutely certain because we don't know enough about the brain to say this is exactly why it works. But we do believe that it mimics REM sleep. So if you think about when you're in REM sleep, your eyes go back and forth when you're dreaming. And we know when people go for long periods of time without dreaming, they have negative symptoms, such as they can get sick, they can start to hallucinate. There's many things when we don't allow ourselves to sleep. So we looked at, well, what does that mean? Is this like REM? Is it possible that while the eyes are moving back and forth, we're mimicking that sleep process? Because we know when we sleep, we are processing information that happened to us in the last 24, 48 hours. So the stimuli that we experience during that time, nothing is forgotten in the subconscious mind and our permanent memory, and everything needs to be processed and stored as memory in some way while we're dreaming. And so if we realize that that's the brain's way of storing memory, and then it was theorized, well, if some memories are very traumatic, they may not get processed and stored in the same way as memories that aren't as traumatic. So then they thought, well, let's see if we actually go back to some of those memories that are very distressing, and memories can be thoughts, feelings, situations. If we focus on those thoughts, feelings, situations while doing the eye movements, or what we call bilateral stimulation, can we help the brain process, reprocess, desensitize, and store the memory without the negative affect associated with it? And the results are quite promising, and they've been validated and replicated, time and time again across all demographics. And it was first really tested or used on veterans and combat veterans in the VA hospitals.
Interesting. Okay.
With amazing results. And obviously this is a soft science. It's very subjective when someone says they're in distress. What does that distress look like? Can we measure that distress, and can we reduce that distress? So we use what we call a SUD scale, which is a subjective units of distress. And when we're doing EMDR, we ask them, a client, when they come in, so we're talking about a situation or event that causes you a great deal of distress. On a scale of 1 to 10, 10 being the worst, where is this event for you? And we want to work on those memories or events that are an 8, 9, or 10.
Okay.
So we're asking them to basically evaluate subjectively how painful that memory is for them, how distressing it is. And then by the end of our sessions, we want to see that that number decreases by several points. And that's our way that we've been able to determine that this therapy is very, very effective, because at least I can only speak for my clients in my practice. I tell my clients that whether it's one issue we're talking about or several traumas, I want to pick one at a time. We want to evaluate it, look at it, talk about all the memories, the cognitions or beliefs that they hold about themselves with that memory, and I'll explain that in a second, and ask them, is it an 8, 9, or 10? And then we'll start with that. We'll start the processing, and by the end of the session, I generally see people at least go 2 to 3 points down, if not more. What the points look like, the distress, is we get to know what their symptoms are. So, for instance, if someone comes in, and this is something that I work a lot with, which is an extreme loss and trauma, is children that have lost, or parents that have lost children. So we're talking about the worst of the worst trauma. That people, they're not doing so well. They've done the traditional talk therapy. Maybe they've gone to the church or the clergy. They've done many different things to help reduce their grief and their loss and their trauma. And by the time they come in to see me, generally, obviously their trauma is at least an 8 much of the day, or most of the days, sometimes a 10. And so what I'll ask them is, tell me what your 10, 9, or 8 looks like. So does it mean that you're not getting out of bed? Does it mean you're drinking too much? Does it mean that you're isolating? All of those different things we want to understand, so we really see, are these things shifting and changing after the EMDR session? So they're giving me a number subjectively of how they feel emotionally, but they're also giving me in follow-up sessions, are they doing things differently in the symptoms that they presented with originally? So are they getting out and connecting with their community? Are they working again? Are they decreasing their alcohol consumption, or whatever they may be doing? So again, we're using that SUD scale, that subjective units of distress, to find out how they're feeling. Are they feeling better? And then we're also assessing their behaviors to see if those have changed as well.
So I'm guessing you're aggregating that data, and how long are you doing EMDR on clients? Is there a set time? Is there an amount of sessions that typically work for someone, say for PTSD or anxiety, or is it just really case by case?
Well, I would say the last one you said, it's case by case. Generally we can say 3 to 4 sessions, you will see a reduction in your distress level. But, that's also subjective. Someone may want to come in and feel better and get over some of their trauma, but they may want to, they may have many traumas. So if someone comes in with that single event, such as, let's say, for example, a client that got in a car accident, and maybe they can't get in a car anymore because they have so much fear. So that one incident, assuming there's not childhood traumas underneath it, that could be a 2-session. The first session I generally do 90 minutes to get to know them, their history, and as much as we can understand, for them to trust me, because it's the subconscious that's doing the work, which is all about self-protection. So I want to make sure that they trust me, they trust the process, and they understand the procedure before we get started. So generally the first session, if we're talking about a 1 incident situation is usually a 90-minute session with about 45 minutes to an hour of talking and getting to know them and understanding exactly what the trauma is, what the belief they hold around that trauma, and what they would also want to think and do differently, because not only are we reducing the distress and helping mitigate some of the negative symptoms, but we're also trying to bring in a positive cognition and bring in positive things in their life as well. So that's done in our talk, the first half of the 90-minute session, and then we start about the second half doing the processing, which is the bilateral stimulation. And then generally we need a follow-up session of 60 minutes or so, and then ideally you want to have another session, at least of 30 minutes of talk therapy, to consolidate and understand all that went on and how they're going to use that information moving forward.
And Dr. Fenton, I'm assuming that this is just one aspect of the Mind, Body, and Beyond Center that now, in conjunction with acupuncture, yoga, Reiki workshops, and spiritual healing, all of these things, that's when holistically you're treating all of the issues for that client.
Absolutely.
And my question to you is, during this pandemic
Sure.
of COVID-19, how are you able to still treat your clients, especially because it is such a holistic approach that you offer?
Right. That's a great question. Thanks for asking. We're obviously we're in the midst of everything. It's the beginning stages of this, so we're uncertain where it's going to go. We're trying to keep our clients connected and helping them with the treatments that they were doing before the pandemic. I have set up telehealth using Zoom, and that's been very helpful for the last couple of weeks, and I'm assuming that I'll continue that, as well as my other therapists will do that. And we also have a career coach and some of the other therapies that can be done through telehealth virtually. As far as acupuncture, yoga, we may be streaming some yoga, but the acupuncture we're going to have to stop. Massage therapy, these other services, unfortunately, are just being suspended for now until this is lifted.
Is EMDR one of those services that needs to be suspended, or can it be offered still through telehealth?
Well, it's funny you should ask that, because I'm in the process right now of working on that. That's on my agenda this weekend, to see if I can create it virtually and it's effective. So I'm going to actually have one of my family members be my client, and we're going to set up in 2 separate rooms. And now EMDR can be done, and I'm sorry, I'm digressing for a moment. EMDR is originally patented. It's done with the fingers, where, I don't know if you know what I'm talking about, where the fingers go back, where someone tracks someone else's fingers going back and forth.
The eye movement.
Yes, the eye movement. That's how it was originally done and patented, and it's powerful. And since that time, we've used other techniques, audio, where someone can put, just having a sound back and forth on each ear, as long as you have bilateral stimulation. So you can either do patting on the knees. I use in my office a tachometer, which is someone holds it in each palm, and it's a pulsating sensation that goes back and forth, right to left. I also, in a lot of psychiatrists I've seen use, it's a gradiating light. I don't know if you've seen that, where it's on a tripod and a light just goes back and forth and you just track it. So I am going to see if I can offer it virtually through the light or just the finger movements with someone on the screen, on their computer, and see if it's just as effective. So my goal is in the next week or two to launch that. But if I can get positive feedback that it's helpful, then certainly I think it's definitely something I will start in the next couple of weeks. I know there are therapists that are doing it online. I just feel that I need to get the feedback the way I do it specifically, and from people that it's effective.
How interesting. Yeah, I think a big part of what we're seeing as well, because we serve a lot of addiction treatment behavioral health entities that are not just outpatient but inpatient, and they do take insurance. So I was going to ask, does Mind, Body, and Beyond Center offer their services and to get reimbursed through insurance, or is it cash pay only?
Yes, it's fee for service, as you say, cash pay only. And I've been doing that even as a psychotherapist for all these years. So all the services, and I especially do it now because unfortunately, many of the services such as career counseling, acupuncture, massage therapy, energy healing, they can't be reimbursed. So as a whole, Mind, Body, and Beyond is fee for service. However, we do offer, especially with my service, where we provide a receipt with a billing code on it so they can submit that for reimbursement. But EMDR is reimbursable.
Yes, it is. Yeah, yes. That's why I was going to ask. But it's not really a big point for you, is to if telehealth would accept that, because that's what we're finding now for those of our customers that do take insurance. Telehealth in certain states, certain therapies and modalities that are provided through telehealth either aren't reimbursed at all, or maybe just a percentage of what they would be in person. So it's been definite a hit for our customers, but really for the clients, and that's what we're all in this for, is to make sure that the clients are getting a better level of care, higher level of care, better quality of care.
Well, I do have to say, one of the silver linings to this pandemic is I do know in many areas the government has pushed pretty quickly a change in coding and reimbursement for telehealth services, at least for physicians. And I'm hoping, I haven't looked to see in the present if it's been for mental health as well. So I think that there's going to be some changes coming fairly quickly, and I hope that helps the clients that are in need of this type of telehealth.
It definitely will. And things are changing very quickly. Wish they could change quicker to adapt, but sometimes government and the Fed takes a little bit of time there.
Sure.
So I wanted to close with speaking about how do you get your clients, and who are the ideal clients for you? I know you'd mentioned a little bit what clients could benefit the most for EMDR, but how could someone find Mind, Body, and Beyond Center, and what would make them a good candidate to work with y'all?
Well, first of all, a lot of people, just presently, a lot of people find us through, Google search or referrals from current clients, also physicians in the community. Our ideal clients are those that are wanting a very nurturing environment with highly skilled practitioners, and really we meet our clients where they are. We have so many different modalities that we offer under one roof that generally our clients are seeing medical doctors, and they're coming here for supplemental therapies. We also have, I didn't mention, we also have a nurse practitioner, doctorate level nurse practitioner, that shares our space with us, and she's fully trained in functional medicine. So we are kind of merging with other, I want to say it, outside the box thinkers that are health conscious and focused on the whole person, but also recognize that there is a time and a place and a necessary place for Western medicine. So especially since where we're located here in Jacksonville, we're just steps away from the Mayo Clinic, and it's a wonderful facility with wonderful medical doctors and staff there. So a lot of our patients, we recommend they still stay with their psychiatrists, their medical doctors, and then we will go ahead and work with them outside of their medical treatment and offer very helpful complementary treatments to round off their health and well-being.
Okay. Very good. And that really concludes it on my end, Dr. Fenton, unless there was something that I missed from our agenda today that you wanted to double dip on or maybe reintroduce. Otherwise, I think we covered the basis of what I was looking for.
Well, good. No, I think that was very thorough, and I really appreciate you asking me these questions. I hope this helps the listening community.
It will. I think a lot of our listeners are either clinicians or owners and directors of facilities that, maybe had heard of EMDR, maybe they've wanted to incorporate it into their programs, but maybe they just haven't had maybe the right clinician to do it.
Sure.
Or maybe the right opportunities to introduce, hey, I think this would be a good opportunity for you to go ahead and learn in the training of it. So I think that you were able to shed some really awesome light on that.
Well, thank you. Thank you so much. And you stay healthy and safe. And
yes, you
we'll
too.
Be in
well,
touch.
I'll try to.
Yes.
Well, all right. Have a great rest of the day. Thanks so much.
Okay. Bye-bye.
Nice meeting you.
Nice meeting
Bye.
you too. Bye-bye.